All right, Dennis, are you tired of feeling like you're running on a hamster wheel, doing tons of procedure, but not seeing the practice growth or personal income that you feel you deserve? Are you looking for ways to significantly boost your practice's profitability and even make your own days more clinically engaging and rewarding? Well, you're in the right place. Today, we're cutting straight to the chase and talking about 5 high profit dental procedures that every practice should seriously consider offering. Or, if you're already offering them, optimizing them for maximum impact. Incorporating these services into your practice or refining on how you deliver them can be an absolute game changer. My goal for you today is to walk away with an understanding that not just what these procedures are, but why they are so powerful for your bottom line and building a practice that gives you more money, more fulfillment, and a better professional life. Many dentists feel stuck in a cycle of high volume, lower margin procedures. They're working incredibly hard, but the financial rewards in the sense of professional accomplishment don't always match the effort. The good news is by strategically adding or emphasizing certain high value services, you can completely change this. These aren't just about making more money. They often involve advanced skills, cutting-edge technology, and delivering truly transformative results for your patients, which is incredibly rewarding and pretty fun. So let's get into it. Here are my top 5 high-profit procedures that I believe have the potential to elevate your practice. First on the list is clear aligners. If you're not offering clear aligners in your practice, you are, in my opinion, leaving a significant opportunity on the table. The demand for clear aligner therapy is booming. Patients of all ages are seeking straighter teeth, not just for aesthetics, but also for improved oral health. And from a profitability standpoint, clear aligners are fantastic. Once you have your systems dialed in and your team trained, the chair time per patient can be relatively low compared to the case fee. Lab fees, while a factor, are manageable, and the overall profit margin can be excellent. What patients love is the discretion, the comfort compared to traditional braces, and the convenience. They can see the transformative power of a confident smile. For your practice, offering clear aligners positions you as a provider of modern, cutting-edge dentistry. It often serves as a gateway to other cosmetic procedures like whitening or veneers, especially once patients see how good their smile can look. Plus, many aspects of clear aligner therapy, like scanning and monitoring, can be effectively delegated to assistants, and that frees up valuable chair time for you. There are many great companies that work pretty well. I try and avoid Invisalign because the fact that they're locked in and you can't use your own scanner is one of the dumbest things that I've heard. Getting started might involve some initial training and investment into your oral scanner if you don't already have one, but the return on that investment can be very quick. Second, and this is a massive revenue driver, are dental implants, with an extra focus on the ability to offer immediate and same-day implant solutions. Implants are a phenomenal service that we can offer. They provide patients with a durable, functional, and a good-looking way to replace missing teeth. The demand for them is consistently strong because, as we all know, a significant portion of our patients walking into our practices are dealing with one or more missing teeth. And an important consideration here is making sure that you have great financing options. The overall investment is often the main concern for patients considering implant treatment. And when we look at profitability, dental implants can be near the top of the list. The advanced skills required, the dedicated training, and the sophisticated technology involved, they all support a higher fee structure. And the positive change that you create in a patient's quality of life is also massive. Now, you can really elevate your implant services, your practice, when you incorporate immediate and same-day placements. This means a patient could potentially leave your office with a whole new tooth or even multiple teeth on the very day of their surgical procedure. That offers an incredible level of convenience and perceived value that patients really appreciate. They really value minimizing overall treatment time and avoiding long periods of time with missing teeth or relying on temporary solutions. Of course, providing these implant services, especially immediate and same-day option, does require a significant commitment. This includes lots of training and investment in technologies like CBCTs and maybe surgical guides and developing that system. But the ability to deliver these life-altering treatments efficiently and with predictability does a couple things. It establishes you as a sought-after clinician in your community, and it provides a dramatic boost to your practice's financial health and your own sense of professional accomplishment. You're addressing major functional and emotional needs for people, and that's a great position to be in. Third on our list of high-profit procedures is to offer and embracing same-day crowns with technologies like CEREC or other chairside CAD/CAM systems. If your practice is still exclusively sending every crown case to a traditional lab, I really encourage you to take a serious look at the benefits of bringing this in-house. The ability to design, mill, and deliver a beautiful, high-quality permanent crown in a single visit is a massive advantage on many fronts. Now, when we talk about profitability, the chairside CAD/CAM, it's not always about direct savings on lab fees because, yes, that money often gets reinvested into equipment, materials, and other training. But here's the real magic, what I've seen time and time again. When dentists incorporate a system like CEREC, the crown process becomes so much more engaging, so much more efficient, and frankly, so much more fun for both the dentist and the patient that they almost invariably end up doing more crown procedures. And that's a huge driver of increased profitability. You become confident in recommending crowns when you know that you can deliver them with such precision and convenience. And beyond that, the chair time savings can be pretty good. You're taking a 2-appointment procedure and condensing it into one. This immediately frees up valuable chair time on your schedule, and you're reducing the overhead associated with that second appointment, the room turnover, the sterilization, the materials, the staff time. And this efficiency allows you to either see more patients or dedicate more time to other productive procedures. And let's talk about the speed with today's technology. It's truly remarkable with the advancements like improved zirconia processing and super fast milling blocks like the Katana Speed Block. We're getting incredibly quick. Honestly, we're almost at the point where you can mill a permanent high-strength zirconia crown in about the same time as it takes a skilled assistant to fabricate a really good temporary. That's a game changer. From the patient's perspective, the benefits are off the charts. They absolutely love the convenience. And think about it, no more messy, goopy traditional impressions, no more temporary crowns that can cause sensitivity, feeling bulky, or worse, fall off at an inconvenient time. And importantly, no need for them to take additional time off work or rearrange their schedule for a second crown delivery appointment. This level of service is a massive practice differentiator and a huge patient experience boost. The initial investment in the CAD/CAM unit and the necessary training is pretty high. There's no question about that, but when you factor in the increased efficiency and the dramatic effect on the patient experience, the complete control that you gain over the quality and fit of your restorations, and the tendency to do more of these valuable procedures because the process is so much better, it becomes an incredibly smart business decision for practices looking to boost profitability and also create a more modern and streamlined workflow. Fourth on our list, and this is a combination that truly supercharges your efficiency and it wows your patients. And this is the 1-appointment end-to-end crown. Let's face it, the vast majority of teeth that require root canal therapy also need the long-term protection of a full coverage crown. So instead of thinking of this as 2 separate multi-visit appointments, imagine the power of completing both the endodontic treatment and delivering the final crown in a single appointment. This isn't just a minor tweak, it's a fundamental shift that massively benefits both the practice's productivity and your patient's overall experience. Consider the profitability aspect. You're taking 2 distinct, high-value procedures and seamlessly integrating them into one highly efficient block of chair time. This dramatically reduces the total chair time involved comparing stretching these procedures out 2 or even 3+ separate visits. You're slashing setup times, breakdown times, minimizing sterilization, and cutting down on all the administrative tasks and overhead associated with many appointments. Your production per hour for that single comprehensive appointment can be absolutely outstanding. And if you're already leveraging same-day crown technology like CEREC for this, that's where it becomes a massive boost. Being able to perform the root canal and then immediately scan, design, mill, and seat the permanent crown without the patient ever having to leave the chair or come back, that's like next level service. For most teeth, you can actually prep and have the crown milling while you are doing the endo. It's amazing efficiency. From the patient's viewpoint, the level of convenience is just pure gold. They get out of pain, especially if it's a symptomatic tooth, and they walk out with their tooth fully treated, restored, and protected all in one go. This means fewer appointments for them to schedule, less time off of work or away from responsibilities, and significantly less hassle. It's a win, and they will definitely rave to their friends about it. Now, to execute this effectively and consistently, a few things need to be in place. You obviously need to be proficient and highly efficient in your endo skills. And as we just discussed, having access to good, CEREC or same-day crown technology is also critical. For true single visit completion, When you can confidently and predictably deliver this level of comprehensive single visit care, it truly sets your practice apart. It clearly positions you as an advanced patient-centric provider. The positive word of mouth and online reviews that come from patients who have experienced this level of efficiency and care are critical and super helpful at attracting more of the patients that you want. And fifth on my list of high profit procedures are wisdom teeth extractions. This might surprise some, but straightforward and even some moderately impacted wisdom teeth extractions can be a very productive and profitable service to offer in-house rather than just routinely referring them out. Many general dentists are comfortable with routine extractions, but they shy away from third molars. However, some additional training, proper instrumentation, and careful case selection, performing many wisdom teeth extractions yourself can really boost your hourly production. Patients often prefer to have procedures done by their, trusted familiar general dentist rather than being referred to an unfamiliar specialist, especially for procedures that can cause anxiety. Being able to offer this service, particularly for those in your patient base with families, it builds loyalty. Keeping these in-house captures revenue that would otherwise be lost to referrals. It's a great way to serve the younger demographic in the practice. And while not every wisdom tooth case may be appropriate for general dentist, developing the skills to confidently and safely manage a good range of them is a smart move for practice growth and profitability. Always prioritize patient safety and work within your comfort zone and skill level, but don't automatically refer out what you could competently and profitably do yourself. So there you have it. 5 high-profit dental procedures: clear aligners, dental implants, same-day crowns, 1 appointment endo crowns, and wisdom teeth extractions. Integrating even 1 or 2 of these more into your practice can make a huge difference. It's not just about the individual procedure fee, it's about the overall increase in your production per hour, the enhanced patient experience, and that leads to more referrals, and the professional satisfaction that comes from mastering advanced skills and delivering truly comprehensive care. If you're looking to break out of that drill, fill, and bill cycle and build a practice that's more financially rewarding, more engaging, and ultimately gives you a better quality of life, then I urge you to evaluate your current service mix and seriously consider how these procedures fit into the vision that you have for your future. If you found this information valuable and you're ready to learn more strategies to make your dental practice more efficient, profitable, and enjoyable, then go ahead and hit the subscribe button. We're all about helping dentists like you succeed. Now, I'd love to hear from you. Which of these 5 high-profit procedures are you currently offering in your practice? And which ones are you most interested in adding or optimizing in the future? Drop your thoughts and questions in the comments below. Let's get a discussion going. So take what you learned today about these 5 high-profit dental procedures and start thinking about how you can implement and enhance them in your practice. Let's keep working together to make dentistry fun, fulfilling, and rewarding. Subscribe so you don't miss the next strategy, and I'll see you soon.